Podcast 7 of the Upper Limb series. The muscles of the anterior forearm. This podcast is going to detail the numerous muscles that are located within the anterior compartment of the forearm. The forearm contains two long bones which extend from the humerus, where they form the elbow joint, to the carpal bones, where they form the wrist joint. These bones are the radius, which is lateral, and the ulnar, which is medial. Running between these two bones is the interosseous membrane, and this separates the forearm into two compartments. The interosseous membrane is a thin but strong fibrous membrane which has two apertures at its proximal and distal ends. These allow blood vessels to pass between the anterior and posterior compartments. Functionally, the interosseous membrane increases the surface area for the attachment of some deep forearm muscles, and also helps to transmit forces from the radius to the ulnar and then to the humerus. So let's now turn to the muscles that reside in the anterior compartment of the forearm. The muscles within this compartment are involved in both flexion and pronation, and this means that anterior compartment is also known as the flexor pronator compartment. So there are 8 muscles in the anterior or the flexor pronator compartment, which are conveniently divided into 3 layers: a superficial layer which has 4 muscles, a middle layer which has a single muscle, and a deep layer which has 3 muscles. So let's start by detailing the muscles in the superficial layer. The 4 muscles within this layer all originate from the medial epicondyle of the humerus, and this site is known as the common flexor origin. These 4 muscles from lateral to medial are pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. You can picture these muscles in your forearm by placing the palm of your hand on the medial epicondyle of the opposite arm. If you point your 4 fingers towards your wrist joint, then these 4 fingers can represent the 4 muscles in this superficial layer. Your index finger resembles pronator teres, your middle finger resembles flexor carpi radialis, your ring finger resembles palmaris longus, and your little finger can resemble flexor carpi ulnaris. So let's describe the details of these muscles. So pronator teres is the shortest of the superficial muscles, and extends from the common flexor origin and the coronoid process of the ulna to the proximal third of the radius, and it forms the medial boundary of the cubital fossa. As pronator teres crosses both the elbow joint and the proximo-radial ulnar joint, it will flex the elbow joint and also rotate the radius, causing pronation of the forearm. Medial to pronator teres is flexor carpi radialis. This is a long muscle that again comes from the common flexor origin, the medial epicondyle, and gives off a long, thin tendon that extends to the base of the second metacarpal by passing through the roof of the carpal tunnel. Contraction of flexor carpi radialis will abduct the hand at the wrist joint. If it contracts alongside flexor carpi ulnaris, then these 2 muscles will cause the hand to flex at the wrist joint. Continuing medially, within the superficial layer, is palmaris longus. This muscle again extends from the common flexor origin to merge with the flexor retinaculum and palmar aponeurosis. Interestingly, this muscle is not present in approximately 15% of the population, and it's involved in flexion of the hand at the wrist joint. The most medially positioned muscle of the 4 in the superficial layer is flexor carpi ulnaris. This muscle again originates from the common flexor origin and has a short muscle belly and a long tendon that extends to the pisiform and hamate bones in the wrist. It also attaches to the 5th metacarpal bone. Contraction of flexor carpi ulnaris is going to adduct the hand at the wrist joint, and like I said previously, if it contracts alongside flexor carpi radialis, these 2 muscles will cause the hand to flex again at the wrist joint. All of the muscles in the superficial layer are supplied by the median nerve, except for flexor carpi ulnaris. This muscle is conveniently supplied by the ulnar nerve. The second, or intermediate layer of muscles in the anterior compartment is occupied by a single muscle, and this is flexor digitorum superficialis. Flexor digitorum superficialis is a flat muscle that is positioned deep to the muscles of the superficial layer, and as its name suggests, is involved in flexion of the digits. This muscle has two heads, a humero-ulnar head and a radial head. The humero-ulnar head comes from the common flexor origin and also the coronoid process of the ulna, whilst the radial head comes from the proximal half of the radius. As it originates from both the ulna and the radius, some fibres of flexor digitorum superficialis originate from the interosseous membrane. The muscle belly gives off 4 independent tendons that each pass into the hand through the carpal tunnel and attach to the middle phalanges of digits 2 to 5. Contraction of flexor digitorum superficialis will initially flex the middle phalanges at the proximal interphalangeal joint. With continued contraction, it will flex the proximal phalanges at the metacarpophalangeal joints. Both heads of flexor digitorum superficialis are supplied by the median nerve. The third and deepest layer of muscles in the anterior compartment is the deep layer. This layer contains 3 muscles: flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. Flexor digitorum profundus originates from the proximal third of the ulna and interosseous membrane, deep to flexor digitorum superficialis. Similar to flexor digitorum superficialis, it gives off 4 long tendons that enter the hand by passing through the carpal tunnel. The tendons of flexor digitorum profundus attach to the distal phalanges of the medial 4 fingers. Now, as the arrangement of these tendons in the hand is rather complicated, I'm going to abbreviate flexor digitorum superficialis into FDS and flexor digitorum profundus into FDP, and this will make explaining it a lot simpler. So as the 4 tendons of FDS attach to the middle phalanges, they split, and the 2 sides of the tendons then attach to the sides of the middle phalanges. This splitting allows the tendons of FDP to pass through them and extend to the distal phalanges. So at each of the 4 medial fingers, the tendon of FDS splits, allowing the deeper FDP tendons to pass through. This allows FDS to attach to the middle phalanges and FDP to attach to the distal phalanges. Flexor digitorum profundus is supplied by 2 nerves. The medial part that gives rise to the tendons of the 5th and 4th digits is supplied by the ulnar nerve, whilst the more lateral part that gives rise to the tendons for the 3rd and 2nd digits is supplied by the median nerve. Contraction of this muscle is the only way the distal interphalangeal joint can be flexed. Further contraction will also flex the proximal interphalangeal joints, then the metacarpophalangeal joints, and finally the wrist. This muscle is the main contributor when you're forming a fist. So let's detail the final 2 muscles in the deep layer, flexor pollicis longus and pronator quadratus. Flexor pollicis longus is lateral to flexor digitorum superficialis and extends from the radius and interosseous membrane and passes a long tendon through the carpal tunnel to the distal phalanx of the thumb. It is also supplied by the median nerve and is involved in flexing the thumb at the interphalangeal joint. The deepest muscle in the deep layer of the anterior muscle compartment is the small quadrangular shaped muscle pronator quadratus, which forms a band across the distal quarters of the radius and ulna. As its name suggests, this muscle is aiding pronator teres in pronation of the forearm. It is supplied by the median nerve. So finally in this podcast, I want to mention an important plane which is located between the superficial and intermediate muscle layers. This neurovascular plane contains the median nerve, which runs between flexor digitorum superficialis and profundus, and the ulnar nerve and artery, which runs between flexor carpi ulnaris and flexor digitorum profundus. So I'll end this podcast by reminding you that the flexor pronator compartment of the forearm has 3 layers: a superficial layer which contains 4 muscles, an intermediate layer which contains a single muscle, and a deep layer which contains 3 muscles. In the next podcast, number 8, I'm going to detail the muscles within the posterior compartment of the forearm.